Ulcerative Colitis by Ana Cardenas, Kimberly Perkins, and Julian Zamora.
Ulcerative colitis is a chronic inflammatory disease of the colon. It typically starts in the rectum and spreads up the colon, causing continuous inflammation of the mucosal layer of the bowel. Inflammation is largely limited to the mucosa, and ulceration is generally shallow. The inflammation causes widespread destruction of tissue. There is currently no single cause for ulcerative colitis. It is believed that genetic predispositions, environmental factors, and the immune system play a role in the disease. The current risk factors include a high level of stress, exposure to air pollution, smoking, non-steroidal anti-inflammatory drugs, poor hygiene, and a diet high in fat and meat. A diet high in vegetables is associated with reduced risk of ulcerative colitis.
Clinical manifestations. Ulcerative colitis is a long-term inflammation that causes sores in the digestive tract. Manifestations of ulcerative colitis appear and develop over time. The complications that arise may range from debilitating to life-threatening, and while treatment can't ease these complications, there is no known cure. The most common manifestations that occur include bloody diarrhea, which may also include pus, abdominal discomfort, weight loss with a loss of appetite, fatigue, fever, tenesmus, which is the need to have a bowel movement even if you've already had one, malabsorption, and nutritional deficiencies. Lab results. Now, there are various lab results and procedures that can help in detecting ulcerative colitis. Some of the most common lab results and procedures include a complete blood count, or CBC, which helps in the detection of infection and anemia, an erythrocyte sedimentation rate, ESR, which can detect inflammation from infections or cancer, a C-reactive protein, or CRP, which is produced from the liver. A high CRP indicates an inflammation, a double contrast barium enema, which investigates the large intestine and shows any abnormalities that may be present in the colon, rectum, a transabdominal ultrasound, which is a non-invasive procedure that helps in determining IBD, a computed tomography or CT scan, which helps create detailed images of the contents in the body, as well as a magnetic resonance imaging or an MRI, which also helps create detailed images of the body by using powerful magnets and radio waves. It detects diseases or injuries within the body. As well as those lab results and procedures, you also have to observe for a decrease in serum sodium, potassium, chloride, bicarbonate, and magnesium levels.
Ulcerative colitis should ideally be managed in the setting of a multidisciplinary team. This includes the patient's primary care doctor, gastroenterologist, nutritionist, etc. The goals of treatment are to rest the bowel, reduce infection, proper nutrition, stress relief, to relieve the symptoms, and to improve the patient's overall quality of life. The resting includes both physical and emotional rest. Ulcerative colitis usually strains a patient's quality of life and causes a high amount of stress. Drug therapy can also be used, including corticosteroids and immunosuppressants. These typically are the first line of defense against ulcerative colitis. However, surgical therapy is also used, and the creation of a colostomy through the removal of the colon is a cure for the disease. Nutritional therapy is also used with the help of a nutritionist to provide adequate nutrition without exacerbating the symptoms of the disease.
In a patient with ulcerative colitis, you might find some of the following nursing diagnoses will fall into play for you. The first is diarrhea, and that's related to the inflammation of the bowel. And you might say something like it's as evidenced by the frequent watery stool that they have or the hyperactive bowel sounds that you hear. The other is acute pain, and that has 3 different options for related to. One is going to just be the skin irritation that's associated with diarrhea, but then you're also going to have the cramping with the hyperperistalsis. But lastly, your patient may very well have had a surgery related to their ulcerative colitis, and then you would have acute pain related to post-surgical incision site. Imbalanced nutrition also has a few different options for related to's. You're going to have impaired absorption because it's moving so quickly through the bowel, and you're going to have nutrient loss as well. But lastly, you might also have a patient that is so tired of ulcerative colitis and this disease and the pain that they're going to actually restrict their intake because they don't want to continue having the diarrhea. So the same diagnosis but very different related to's on that. The deficient fluid volume is going to be with the abnormal fluid loss that you're going to have, again with the diarrhea, but you're also, in this situation, you could have a hypermetabolic state. And with that, you're going to have fluid loss as well. That's going to be the fever and things like that. Anxiety is going to be related to this situation with colitis as well, because you're going to have a major adjustment in your lifestyle and your health status, and not being able to leave the house because of the diarrhea, things like that, or having the fear of that happening. And you, if you do have something like an ileostomy, you're going to have a role function change, and that's going to change a lot of your daily care things that you do. So both of those can cause an anxiety in a patient. There is always the risk for infection with the altered skin integrity that you're going to have, but also with the alteration in the peristalsis that they have. And lastly, the risk for sexual dysfunction. And if you imagine, again, there's an alteration in your body function here, and it's also you are looking at different things that you're going to have to struggle with, and that you're going to hope that your spouse or partner is not going to find unattractive about you. Potential complications with ulcerative colitis are the next 2 slides, and a key to that is going to be early intervention and the patient participating in the prevention of these complications. And that's going to mean following their therapies, proper nutrition, taking their medications. If they start to have a problem, to get into the doctor or the hospital early, and that will have a major impact on how some of this affects their life. And I've listed quite a few with pictures to keep you entertained on the side. The blood clots are always a risk with anything that's going to actually start your coagulation factors going. And if you look at the guy with the belly sticking out, that's the toxic megacolon. And we don't have a lot of time to talk about it, but you can definitely read the rest of this slide to find out. The arthritis, and then the primary sclerosing cholangitis is actually the bile ducts of the liver get scarred on that one. The complications on this page for ulcerative colitis are going to be your osteoporosis, and a lot of that has to do with that inflammation in the bowel and the malabsorption. And you have 2 pictures showing you what happens to your bones as that progresses. Bowel cancer is you're just at an increased risk for it. Especially after you've had something like ulcerative colitis for 8 or 10 years. So you want to be good about your checkups and preventative care there. The skin disorders, you can get canker sores in your mouth, things like that. The picture shows you erythema nodosum, and that's very painful, and you get the lesions on your legs usually, but they can be other places. And then you have bleeding, which the only picture I could find was that blood drop, so that's what you get. But that can also be hemorrhaging, and obviously you have these ulcers forming in your colon, so you're going to see that blood in the stool. And then the last is complication you can have with your eyes, and that's going to be inflammation in that pigmented portion. And again, if you can get in early and they treat this, you have a great chance to fix it. But anything that's run its course without your patient being good about coming in and following through on their therapies is going to be problematic for them. Lastly, on several of these options too, and I listed it specifically on the eye problem, is if they're smoking, that's a big problem and they need to stop that too. References used.